there.
How you doing?
Okay. How are you?
Not too bad. My name is Isaac. I'm a student with Walsh University. I'll be your occupational therapy tormentor today. Is your name?
My name is Bill.
All right, that matches. How old are you, Bill?
You know, I might be 53, but I feel younger some days, older other days.
Yeah, it's kind of like me.
Yeah.
I try to be younger. I try to forget my birthday, but you keep catching up with me. What brings you in here to see me?
I got in a car accident, broke some bone in my hand, and my head kind of hurts.
Okay, well that kind of tracks with what I got here on my sheet. It's a little concussion action, metacarpal fracture, and it says you got a little contusion, which is a bruise on your elbow. Okay.
It is a little tender.
A little tender. You having any pain right now?
A little.
Give me 1 to 10 since you're having pain. 1 being tiny a bit, 10 being the most pain you've ever felt in your entire life.
Well, right now not too bad. I'd say maybe about a 3.
I don't know. They got you on some pain medication.
They do.
Very good.
I'm thankful for that.
That's true. That's true.
Mhm.
Keep the pain down.
Mm-hmm.
Now it says here you're non-weight bearing on that hand. You know what that means?
That I can't push up with it.
Or
Use it to move anything, probably.
there you go. Pretty much.
Okay,
Pretty much
okay.
anything. You're not able to push, pull, punch anybody, or do anything like that. Okay.
All right.
None of that stuff.
I'll try to behave.
We're going to be going over. It looks like it has a little bit of swelling there. We're going to go over some what's called edema precautions or protocol. And I'd like to see how you're getting around. It says you've been here for a couple of days, so you could still use ice to help with that edema. Ice and elevation.
That does feel pretty good.
Okay. As well as your pain medication.
Yes.
So, tell me a little bit about. Are you having any other pain? You said a little bit about a headache.
Yeah, just my head and elbow and my hand. This left side's a bit tender.
Okay. Well, we're going to be doing some assessments on you, see how you're getting around. Probably to prepare you for going home. You won't be here long with a mild concussion and with your injury. We're going to be taking a look at you to make sure there's nothing permanent. If you know what I mean. So we'll be going over. They already did a Rivermead post-concussion assessment questionnaire, but we're going to redo that as well. That's how they.
Why did I do really bad?
No, but that's how we can track your symptoms.
Okay.
So, and make sure, because some of them are short term, or you know what I mean. The other ones kind of come on later. So
Okay.
that's how we track them. So, all right. And you are right-handed, right?
Yes.
That's what I saw on the chart.
Yes.
Okay. Well, that's a good thing.
Yes.
I do have a gait belt, and I don't know if you've seen them before, but that's just for our safety and your safety. I'll put it
Okay.
around you, and I do want to test how you're getting around. Okay.
Okay.
So I'd like to do a transfer if that's okay.
Sure.
You can put down my notes here.
Does that mean you'll be moving me to my bed?
It is. I
Okay.
just want to see how you're getting in and out without putting pressure through that hand.
All right.
Okay.
I'll give it my best shot.
So let's lock down your chair.
Yep.
Safety first.
Yep.
Lean forward.
Okay.
Just be very careful with that hand.
Okay.
Yep. And then we're gonna. Okay, we got it. Now it's gonna loosen up as you stand. Okay.
Okay. Okay. So
And I'm gonna be standing here.
Okay.
What I want you to do is you're gonna kind of scoot out to the edge just a little bit. How you feel? How's your head? Is it okay?
Yeah, it's all right. It's all right.
Yep,
I'm
good.
only a little dizzy.
Whoa, dizzy. Better not be.
Well, not really.
Oh, just kidding. All right. Get your feet in position.
Yep.
Underneath you, spread them apart.
Okay.
You're gonna lean forward.
All right.
Push up. Same time, stand
Alright,
up. Ooh,
okay.
very good. I didn't have to help you at all. My hands are just on you.
Yeah. Alright, so then I would just,
Yeah.
walk on
Walk
over.
over here.
All
Actually,
right.
let's go all the way around.
All
Let's see
right,
how
all
you're,
right.
how you're moving around.
Yeah.
Very
Okay.
nice.
Thanks.
Just contact guard as what we call it.
Yes. Alright.
Just have a hand on here.
Mm-hmm.
Mhm.
Okay.
Now,
Alright, can
yes.
I sit down
Now, well, when you feel the bed on the back of your legs,
Yep.
can you feel it?
Mm-hmm.
Right, now you want to sit down nice and gently, just using your right hand to help.
Mm-hmm.
What do you think?
Oh, this is great.
All right.
I didn't even bump into anything.
Right. Now, what do you think?
Oh, I think I can handle this.
Think you can handle that? What about
Yeah.
laying down?
We can give it a try. I think we could do it.
Let's see.
All
see
right.
what you got.
Alright.
Again.
Oh yeah, this
Oh,
is nice.
man. You're out, Bill.
Yeah.
Bill's gonna be sleeping.
I just need a little pillow for my arm.
That's right. Well, we're
And
talking
I'll be
about that.
set.
Let's see how you get out.
Alright. I just need 1 minute before I
Yep.
stand back up here.
Always, yeah.
Okay.
Reset that blood flow.
Mm-hmm.
Get your balance, get your bearings. Breathe. Ready?
I'm ready.
Okay. We're
All
gonna go
right.
back over there.
Okay.
You can.
I can walk a little faster. I don't know if I
Great.
can. You still feeling okay?
Yeah.
Alright.
It's that little headache.
Okay. Well, we do want to send you home as soon as possible, so we want to make sure that your right side is nice and strong, and that will kind of help you pull on your pants, get dressed, everything.
Okay.
So in order to make sure that you're strong enough, we're just going to do a few tests to test your grip strength and a few other things. So we'll start with this.
Okay.
This fancy tool here. In just a minute, I'm going to have you squeeze this as hard as you possibly can without causing extreme pain. But we just want to test your strength and see if you are within normal range for your age group.
My right.
All right. Your
Only.
right hand. Your right hand. We definitely don't want to stress out the left right now.
Put the strap
Okay.
on.
And let's put the strap on here so we don't.
Why is it expensive?
It's yes, it is. So
Very
all right, when
expensive.
you're ready, squeeze as hard as you can. Squeeze,
Okay.
squeeze. Oh wow. Okay. All right. Great. Thank
Okay.
you. Bill, here's another assessment. We're going to check your fine motor skills, and we were also going to see how you would do with your coordination. I'm going to demonstrate, then I'll move it closer to you. Again, this is just with your right hand. We're going to take a
Okay.
peg once I start the timer, and one at a time, you're going to put the pegs in the holes.
What's this called?
This is called the 9-hole peg test.
Ooh, fancy
And then,
name.
yes, and then once you have put all the hole pegs in holes, you will just start putting them back in the pile, and then we'll stop the timer.
I can pick them up all at the same time?
Nope, one at
Oh,
a time.
one at a time.
One at a time.
Okay.
All right, so I'm gonna move this down closer to you, and then once you're ready, I will start my timer.
Okay, you got your timer?
I do.
So when I start or when you start?
Well, why don't you start now?
Okay. Ooh, yeah, that's tough. That headache.
Whew. Doing great.
Then take them out? Okay.
Excellent.
Oh boy. Slippery little suckers.
They are.
Okay.
Okay.
How'd I do?
Great time.
Right.
Phil, your range of motion on your right side is wonderful. You have a full range of motion, and your muscle testing, your strength was great, all within normal range.
Oh, good.
So I'd say
That's good to hear.
the right side is nice and strong.
Yep.
The left side, however, we need to catch up a little bit. What are you having trouble with right now?
Oh, probably a little bit getting dressed because I can't
Okay.
use my hand.
Well, good news. That's one of the assessments that we need to do on you. So if you don't mind, I would love to help you put on this sweater you have in your
Okay.
that you had in your closet. Okay. All right.
Try and see how I can put that on. So what do you do here?
All right. So just like you, would at home, just kind of pick that up with your right hand.
Okay.
And then, yep, just thread it through if you can, if it's not causing you any pain.
Oh, it's already in pain.
Oh,
so-
geez. Okay, I can help you a little bit if needed. All right, we'll just wiggle that up.
Then what do I do?
Now, I'm gonna
Do
help
I
you.
stand? Do I sit?
I think you should still sit here, and I'm
Okay.
gonna help you pull this around your shoulder here.
Okay.
All right, and then if you could just reach your hand back, okay, and push that
Oh.
through. Good, excellent.
Yeah, I was having trouble with that. Okay.
Yes.
Well,
Okay.
this feels much more comfortable out of this
Good.
this thing.
Yes.
They can
Yes.
keep this hospital gown.
I know.
I work a lot. I mean, over 60 hours a week.
Yes. Okay. Well, we will certainly work with you, and we'll develop some goals to get you back to work. But I bet you it's a pretty stressful job, and if you're working 60 hours a week, I think we should come up with a plan. What do you think about maybe working a little bit less hours, ease you back into work, so we don't overburden this left arm?
I like the money.
True.
The wife and kids like the money.
I bet. Well, but we don't want you to to further injure your hand and then be out of even more work. So maybe we could think about making the customized goal of a slightly different work schedule, if you're okay with that.
Yeah, you're probably right.
Okay.
You know, probably would make sense to cut back a little bit. It is a stressful job.
All right. Well, we'll work together on that.
Okay. And you talked earlier about the swelling. You got.
Yes, I have a pamphlet for you actually that
Okay.
goes all over the edema and swelling that you might be
Okay.
experiencing. So it gives you lots of tips and tricks for at home to continue with the same type of pillow you've been using here.
Great.
Ice 20 minutes on, 20 minutes off, but as the days pass, you might not need it as much.
Yeah, I didn't figure it'd help so much later on, but.
Right.
Okay.
Yeah, we've
Very
got all
good.
kinds of goodies for you before sending you home. So we want to
Okay.
just set you up for success and be the best possible version of you as you could be with this injury taking place.
Right.
So.
Well, don't you worry. I will be suing.
Oh. Bill, I think we have some great goals that we'll be working on. We'll go over some additional tips and tricks for dressing one-handed. We'll go over some simple one-handed meal prep, since we'll have to get you back to doing that.
Yeah, I guess I gotta eat. I like to eat.
Okay, good. But we do want to also talk to you about your high cholesterol because that does put you at a higher risk for a stroke, and we don't want to see you back here for a stroke.
I figured that would come up. Is that in my chart?
It is,
Yeah.
it is. Yep, the doctor tattled on you.
Right.
So we have this pamphlet here that goes over some healthy kind of trade-outs for maybe some things like butter. You know, you could use avocado oil
Love
instead. It is good.
It is good.
Can't
Butter's good.
deny that. But hopefully there's some things that we can incorporate into your goals. So again, to prevent any future strokes or anything like that, which of course you haven't had yet. And knock on wood, we won't be
So
seeing
you're
you back there
saying
for
I'm
that.
more likely to have a stroke?
You could be with the high cholesterol, yes, especially if you're in a stressful environment with your job,
Oh.
and then a stressful car accident
Mm.
that could put you at a greater risk.
Oh, that is scary. So
It
maybe I
is.
should pay attention.
That would be good.
All right.
Okay. All right, Bill. Well, it's been a pleasure working with you, and I look forward to working with you later this week.
Thank you.
Looks like I'll be seeing you in 2 days.
Okay.
All right.
Good. Thank
Good.
you.